After Exposure, Asbestos and Mesothelioma Stories, a podcast from the Mesothelioma Center at asbestos.com. On this episode, we discuss AI in cancer care. Your host is Walter Pacheco, managing editor at asbestos.com.
So welcome to our podcast. Thank you very much for being here.
Thank you for the invitation.
We'll start out with you. Tell us a little bit about yourself, Dr. Rodriguez, and how you got involved in mesothelioma, and then we'll talk a little bit about the AI stuff.
Oh, perfect. Great. Well, thank you so much for the invitation, and great to be part of this conversation. So I'm a thoracic medical oncologist, which means that I take care of patients that have lung cancer and mesothelioma mostly at the Sylvester Comprehensive Cancer Center at the University of Miami. And the reason why I do this is that when I was training at the University of Pennsylvania, I got to meet a lot of patients that presented with mesothelioma, and we had a SPORE kind of research program there for mesothelioma, so I got a lot of experience. So when I moved to the Miami area to do more of my work, I lead the research program here at the University of Miami. I just really, my interest in clinical trials and finding solutions for cancers that we have not found solutions. And mesothelioma patients are really special to me. Their caregivers are very special to me because it's a rare disease that has been underfunded, and a lot of companies don't really make that investment. So there's a lot to do, and that really is a passion of why I'm interested and excited that we're able to treat those patients here in Miami.
That's great. That's great. The reason I had asked you to come on the podcast was Dr. Catherine Perot, our medical officer, had spotted an Instagram post that you had talking about how people, how to use AI in cancer care. As you know, we all know AI is in every aspect of life nowadays. And I'm curious to hear about, when did you start noticing your patients using AI, and what was their experience with it?
So it's actually been something that has grown over the last year. It's kind of, I think our kids, I have young kids, I think they've been using AI to do their homework for some time. I think adults, especially older adults, have not been using AI, but they've been using internet, and about 80% of people that are diagnosed with cancer, besides finding conversations with doctors, they're actually finding information online. So I think AI is the evolution of us using the internet to get information, to learn about a new diagnosis and what is the treatment. But I have started noticing of late that patients come with a printout of questions. And in the past, that used to be something that a few patients that had gone in the NCI website. But now it's a lot of patients that are, or their caregivers have these pages. And when I ask them about it, first of all, the questions are better, like they're very structured. So it's a good thing. And sometimes patients have this kind of AI, ChatGPT and other tools generated summaries of what mesothelioma is. And I think that's a great place to start. And it's really more of a curiosity for me rather than a concern. I think it's actually great that patients are using these tools to kind of empower themselves. And AI is really allowing patients to kind of do this in a very personalized way. So you could kind of put a question and get an answer that relates to your specific question. So that is very conversational and it's very fast. I think the challenges is what patients do with that information.
So that brings me to the next question. What kind of questions specifically about their diagnosis or potential treatments are they coming in? I think it's great that they're coming in prepared with a list. This is one of the things that AI is really good for, to give you a little bit of some recommendations. Perhaps sometimes the recommendations aren't always accurate, but at least they're coming in with a list of questions. What are the types of questions that you're seeing about their diagnosis and treatment? And are you finding that these questions are a little bit better informed than they were before?
Yeah, I think, so in the past, like go back 10 years, even when I was training in the Northeast, like only a few patients who had access to mesothelioma centers with a few surgeons who knew how to do these surgeries well. really got FaceTime with doctors who really knew about this. So I think in a way, AI and the internet has really leveled the playing field where there's a lot of information that people can access, especially if you're not able to travel to these big centers. But I do think that most of the questions that people are asking have to do with prognosis, like how am I going to do? What was the 5-year survival? Treatment options. And I think surgery as an option is something that is being very debated in mesothelioma. So I think even the answers you get from AI are not very clear about what you should do about surgery, but I think it's a place to start. I also kind of feel like patients sometimes look for the more obscure treatments that we don't even use, like, the ivermectins and the other things that we don't have a lot of data. People really want to learn about. So I think those are questions that people pose because they feel doctors don't talk about them. But I think the more appropriate, useful questions have been the ones that have to do with prognosis and treatment options and who's a candidate for surgery and what are the systemic therapies like immunotherapy, chemotherapy, and what are the side effects. So I think some of those are great. I think the other set of questions and that people want to know is like, where should I go for clinical trials? And I have to say, even AI today doesn't have a great answer for that, because even in our centers, we really struggle to match people with trials because there are not that many trials, and some of those spots are not available at every given point. So again, it's a good place to start for patients. And I think especially with a rare diagnosis with mesothelioma, where a local doctor may not have treated a patient and patients get misdiagnosed sometimes, I think it's a good place to kind of get information so that at least when you sit in front of a doctor, you can ask the right questions and at least be kind of sent in the direction of where you can find the right answers.
Do you find, especially with mesothelioma, where you have an older population that is diagnosed, as I mentioned earlier, AI is part of a lot of aspects of life. Do you find that there's a difference in ages of your patients, in their level of use of AI, or even is there a level of trustworthiness that they have in the AI? Is it separated by age groups that you could think of? If you could just talk a little bit about that.
Yeah, I mean, there is a big digital divide that has some of it has to do with age, because there's still people in this country who don't have access to internet. That's a real reality in some rural communities. And then there's some older populations who didn't grow up with computers to the extent that our kids are. So for them, really going to the internet to find solutions feels very impersonal, and they don't know where to start. But that being said, I will tell you, last week I had a woman, a caregiver, came with her husband, and she told me that her grandson in another state helped her interpret her CAT scan by going in Claude, which I think is a next level chat kind of AI tool. And she was so happy that her son helped her with her grandson helped her with this. So I've seen a lot of this, like the generational kind of intergenerational kind of conversations where like someone younger in the family is allowing older patients to feel comfortable. And that's all really good. And I really would encourage older patients. You still need a conversation kind of face to face, but I do think that this is allowing people to find information that was hard to get in the past. And I think knowing where to look and how to ask those questions, I think is the thing that we need to learn for ourselves and for our patients to guide them with that.
Yeah, we get a lot of, usually it's a younger family member will contact us, and they've already most likely either used our website to find, questions to ask your doctor, have gone on Google to find other assets that have that, or are using AI to build that together, because usually the older generation may not be using any of these technologies. So I'm not surprised that you're seeing what you're seeing. But also something else I found interesting, that you're saying they still need, obviously, the face-to-face. That's what always happens with AI. You always need a human aspect. So when someone comes into your office and they're semi-prepared with some questions that they generated from AI, where do you take it from there?
Yeah, so I one of the things I have learned, even myself using AI, is that AI is very authoritative in the way that they deliver answers, because they just have an algorithm. Number one, the algorithm is only giving you things that go to the top, that are published and that are highly cited. So there might be information that is in abstract form that doctors know about, that experts knows about, that AI doesn't have access to. So just because it sounds like the answer looks right, it doesn't mean that it's right. And I think that that's something that I always start telling patients, that this is a great place to start, but kind of let's look at see the answer that you got and what I know from being in this field that we can learn about your case. So I think we have to learn that AI it's not an authority. Like, the one thing I think is, when you talk to a doctor, doctors can also be an authority, but sometimes, I mean, I hope doctors can tell you what they know and what we don't know about the field, because there's a lot of things that we don't know. And AI won't tell you that. Like, AI, when you put a question, it will give you an answer, but it rarely tells you, oh, we don't know this. And I think that's what you gain from this. Is a good kind of beginning of the conversation, but you need to sit with a doctor that can kind of fill in the gaps of what we know and what we don't know, and what's included in the internet and what's not included in the internet, because you're not going to get the full story. But I do think AI can help you get a very structured list of questions. And there's a lot of jargon that doctors use when they talk about surgeries and when they talk about treatments. And I think, especially for medical literacy, like, we have patients that come from family of doctors, and a doctor comes with them, and it's like everything, the conversation seems to be very high level in that sense, because there's people who are medical in the family. But the majority of patients have maybe, like, I call like the healthcare expert in the family, maybe like a nurse or someone who's like a family member that is affiliated with healthcare, but may not be in oncology. So you don't have experts in your family. So you kind of really rely on your doctor to help you translate this. And I think AI tools can help you kind of understand what the doctor mentioned that you didn't really like comprehend. And sometimes patients are embarrassed. I'm sometimes embarrassed to kind of ask questions when I go to see my doctor, because I feel like I should know that. And I think it's kind of helps you kind of fill in the gap. So I guess the bottom line here is that AI is not the end all. There's a lot of things that are missed, especially in rare diseases that are not well published. And that the answer may sound like the real answer, but it may have a lot of missing parts. And I think it's important to have a conversation with your doctor about what you're reading online, so that you can make the best decision for yourself.
Do you think when you explain that to patients, and I know what you mean, where, the AI generator will come up with something that does sound logical, and you're like, oh, okay, that sounds right. And then you're in the office and you're explaining them that it's not quite like that. Does that ever discourage them from continuing to use AI, even if you're telling them most of this information is correct, or maybe it's not completely correct? Do you feel that maybe they're discouraged by using it, or they're okay still continuing to use those tools?
Yeah, I mean, I think we should encourage patients always to be their own advocates and always to try to find informations and answers. And when they do come to me with what I think is not enough or a good answer, I think just having an open conversation about it doesn't discourage patients. At least they understand why, we don't recommend some treatments that, because there's a lot of people, not only AI, there's a lot of people that now are on YouTube with videos about life-saving treatments that we don't think are life-saving. And someone who has an anecdotal story of a country where they found a cure that no one else knows about. So there's a lot of pitfalls in internet because there's no control. And we want patients to bring that information to us so we can have an open conversation and a transparent conversation about what we know and what we don't know. There is good information out there. I think there's a lot of advocacy groups like yourself who are really trying to vet the information with experts in the field. And unfortunately, there's a lot of groups that do not. There's a lot of information out there that is not, no one is vetting it. It's not scientifically sound. And patients wouldn't know the difference. So I think if we don't have an open conversation with our patients about what they're reading, we're not going to be able to fill in the gaps. But I think patients they appreciate the fact that we respect what they're researching on their own, and we applaud the fact that they're being advocates. But they don't want to be told that they're doing the wrong thing, because we don't want to make our patients feel like they're doing something wrong, or like we don't want to shy away from them doing research. I think that's really important.
In a way, I mean, there's been a lot of study about how health literacy here in the US wasn't that great. You know, a lot of people were not going online to get information about, anything health related. So if anything, it's kind of promoted that. You mentioned earlier a little bit about, specifically surgery. I know I was looking for something up the other day and I was using Claude to kind of clarify something about the Mars 2 trial, which introduced a bit more complex conversation about surgery. That I already see it pop up in different AI models, and it's never quite as clear as actually talking to your doctor about, yes, do you recommend surgery? No, do you not recommend surgery? Are those conversations happening because they're seeing something about Mars 2 pop up in AI and they want to have a conversation about that?
I haven't seen someone come in with specific questions about this specific trial yet. But it is something that in our conferences, we have a lot of back and forth. And I could imagine that if we, in a conference of experts who've been doing this for like 20, 30 years, we can get a consensus, or we find that the data of that trial doesn't apply to every patient, I kind of feel like AI is not going to be able to give us a better answer, because if the people who were even part of that trial still have questions about who that trial applies to and who really is a candidate for surgery, I think this is why we need to be open and transparent and really kind of welcome those questions from our patients. So if they do mention Mars 2, I'm like, great, let's talk about it. And actually, at Sylvester, the mesothelioma cases, we tend to see them together with our surgeon who specializes in mesothelioma, because I think it's a multidisciplinary discussion about who's a candidate from surgery and what can we do to make that surgery the best surgery. Because the Mars 2 data, you could read it, or AI could read it, like surgery is not an option for anyone anymore. And that's not what that trial was about. That trial, I interpreted, and many people interpreted, is that you now need to be very selective about who really benefits from surgery, and that there's a group that we could harm by offering surgery. And really being able to tease that out is something that even in the discussion of this trial, we didn't get a really clear answer. Was it a problem with the staging? Was it a problem with the type of surgery and who was doing the surgery? So a lot of nuance that I don't think AI, because even in our conferences, we go back and forth about, I think AI cannot give you a true answer on that. So I think if you typed in, is surgery the best option for me? I don't think that's the best use of AI, because I think that the only way to answer that question is for a doctor to meet you in person, understand the nuance of your presentation, your lung function, look at your images closely, and kind of talk to a team of doctors that are doing this together. Like, can we make the surgery safer? Do we have the right staging studies? And are you the best candidate? But so it has so many variables that AI couldn't really answer that for you.
That brings us sort of into the next part of the pitfalls and dangers of using AI for any kind of health information. Obviously, with cancer, it's one of those even more critical areas where you want to make sure that the answers you are getting from anyone, whether you're Googling it or using ChatGPT or Claude for your information. What do you feel are some of the pitfalls of people searching online and they're engaged with their research, but what are the pitfalls that they may encounter? And like, what would you tell a patient? Hey, this is probably something you should flag as something you should ask me about.
So, I mean, I think the pitfalls to me is that some of the answers look so authoritative and they seem right, but they're not right. So I think people need to understand that, especially in a rare disease like mesothelioma, not a lot of this is expert opinion and experience that gets people to the best outcomes. And AI cannot capture that when you ask a question. And I think, does it really apply to you has a lot to do, like the details of your histology, how the mesothelioma looks on the microscope. Is it sarcomatoid? Is it biphasic? Is it epithelial? All of these variables matter. And if you don't really tell AI, or even if your doctor doesn't take that into account, you really can make a complex decision like that. So there's a lot of subtle details about mesothelioma specifically, about the staging and who's a candidate for surgery. We're also learning about new molecular findings in mesothelioma, where there might be treatment options, including clinical trials. And if you don't ask that question, you're not going to get that. And if you don't talk to a doctor that is well-versed on mesothelioma, you're not going to get those options. So I think the caution here is that if you only rely on AI, you limit yourself, because AI is limited, especially in a rare disease like mesothelioma. Is kind of going on the web and only looking at published data on a rare disease. So, look at how many trials were published in the New England Journal of Mesothelioma last year. 0. So they're not going to get all of the data that we're learning about, the preclinical data before things go into trial, what centers of excellence have learned and done. So you're going to miss a lot of information. I think in mesothelioma particularly, you will miss a lot by just relying on this. And also the prognosis of mesothelioma is very variable. So one of the things I will caution people about is that sometimes you go in this rabbit hole, and it keeps taking you to a very dark place of prognosis. And that is not good for patients. It's very anxiety provoking. And it also always sets you to like the worst place, the worst case scenario in some cases. And I think you have to give yourself, with a new diagnosis that is tough like this, the opportunity to talk to doctors that are willing to do more and willing to look at your case, individual characteristics, and find options for you, including clinical trials. And sometimes second opinions, it's not going into AI to get a second opinion. It's actually you need to go to another doctor who treats mesothelioma to get an opinion, or go to a center that has clinical trials to get those options. So you still have to reach out to people. Not all of the things you need are available online.
When patients or their loved ones come in with these questions, are there any things you tell them, like to caution them what to look for, to make sure that something maybe comes from a reputable, because usually the AI will tell you where it sourced the information from.
Yeah.
Is there any kind of guidance that you give patients coming in or their loved ones who are searching online using AI? What kind of guidance do you give them to be like, hey, this is probably a reputable site, and this is an example of a site that is not reputable?
Yeah, so if they give you references to like well-vetted sites like the American Society of Clinical Oncology Plural Mesothelioma Guidelines, which were just released, like if it refers to that, that is already a very well, experts review those guidelines, like the references in those guidelines are correct. The National Cancer Institute also has very well, vetted information, and they have a Mesothelioma Center there. So those references are true, but we have seen AI outputs that create fake references. So you want to at least kind of know that if the opinion you're getting is referring you back to a page of a guideline that you can find that is, well vetted like those, I think that those are good answers for you, or I guess a good place to start. It's just not the whole answer. It's just a good starting point.
Another thing to talk about, and this has been discussed very recently as well, where people are choosing to follow an AI medical recommendation or a health recommendation instead of going to their doctors. There's been reports of people using it for, maybe resolve an emotional crisis that they're having. And it hasn't always worked out in the best way. Do you think that even though AI is serving a certain niche of giving people answers very quickly, do you think that it ever is interrupting the relationship between a doctor and a patient, where a patient is choosing, well, I learned from what I got from AI, I don't really need to go to the doctor and ask them that? Do you think that could be happening?
I mean, I think some of that is happening, and I think one of the worrisome things is that, especially in a rare disease like mesothelioma, a lot of doctors out there haven't been up to date with what's the latest and when how people can do well, or what the treatments are, and how immunotherapy has really made a difference. So even if you go to people who are not well versed, you're not going to get the full answer. I find like it's really a pitfall that people can go online and decide, well, I'm not going to even talk to a surgeon because I already looked it up and it's not going to help me. I feel that that's not giving yourself the best chances of survival by limiting yourself by why this computer algorithm decided, because again, it's an algorithm of information that is available, and it kind of goes to the top, like it has the most likes and most citations. It's not the universe of data, and it's not the universe of experience in mesothelioma. So I don't particularly haven't seen patients who have stopped care because of an AI recommendation, but probably they are, and I don't know about it. And I hope more of our patients are open, and that doctors are open to these discussions, because I have seen, however, not in mesothelioma, but I have seen, and I don't want to get into, but the whole ivermectin study, I have seen patients who have started treatment on their own, and when we have talked about it, and I have seen patients stop treatment because they were feeling a little bit better and they saw videos about this other alternative treatment. And that has always been the case. I don't think AI is making that more, but it's always been the case that there's a lot of information out there that can give patients false hope, and it motivates people to stop treatment. And I wish that was not the case.
Speaking of that a little bit, it deals a little bit with AI, but also I see a lot of influencers all the time sort of promoting maybe a supplement. And we're always telling our patients, if there is a supplement out there that you're interested in, always talk to your doctor first, because you never know how some small part of that supplement may impact either your current treatment. It may cause a symptom, because not everyone is undergoing the same condition you are. Do you see that a lot too, where patients are coming in saying, hey, I heard about this, or I want to start using this? How do you counsel patients when they come up with that kind of request?
Yeah. So I think two things there. I sometimes see patients that family members are buying them these vitamins because the family members want to do something.
Mm-hmm.
And I think that is not a bad thing. I think people around you care and they want to help you. And I think also patients see themselves in a situation where there are limited options and they want to find solutions. So I think that the energy behind trying to find solutions is not a bad thing. I think it's that you're right. Like some of these vitamins may counteract your treatment. They may not be advisable during radiation if you get radiation. So you should feel comfortable talking to your doctors about what you're taking. And I always we have a pharmacist. We have the luxury of having a pharmacist of oncologists, and she helps us go through the list of what patients are taking and the things we're going to give to see if there's any interactions. And some things you can continue, and some things we find that, we're going to hold it for now, especially because some of these things don't have the best data. So let's hold that while we make sure you're responding, and then we can revisit this. But I think if you don't talk to your doctors about it, you don't read, because you're scared they're going to judge you, or they're scared they're going to, say this is ignorant or something. I don't want patients to feel like that. I want patients to feel comfortable talking to their doctors. There are vitamins that are helpful. Actually, even in immunotherapy, there is data about probiotics. There's data about how to nutrition and exercise that can improve your immune system response. And all of those things are really good. And we want patients to take it upon themselves to do those things. But I think when you find things online that you buy, they give you, I think my problem is unrealistic expectations that you're being sold something that is going to fix it. And if it was that simple, we already would have found a cure for mesothelioma. So just kind of take it with a grain of salt. Please don't spend your life savings on some of these things. At least try to talk to a doctor about it first.
Yeah. Do you think that a lot of doctors are embracing AI for things like cancer care, and specifically about in a patient relationship? Are they embracing that patients are coming in a little bit more knowledgeable? And if so, like, how do you see that embrace?
Yeah, well, number one, I think it would be kind of hypocritical for doctors to say AI is bad, because AI has infiltrated electronic medical records, NCCN guidelines, and ASCO guidelines are being plugged in to OpenAI and Claude. So like doctors are already using this for themselves, because there's so much data, especially for community oncologists that treat many cancers. Like I only treat thoracic malignancy, so I can kind of stay up on top of most of the publications. But even even someone who just does lung cancer still needs help keeping up with the data. So I think doctors are using AI. So the patients also should use AI. And how that impacts the communication with patients, I think you could communicate more clearly and transparently when patients already come knowing something, or at least asking some questions. So I would hope physicians see this as an opportunity to have more open, transparent conversations and kind of leveling the playing field, and that we move away from this paternalistic, like, oh, this is what we need, this is what you should do, without an explanation. Because I think that doesn't help patients. I think patients need to understand why this is good, why this is not good, and why I made this decision. And also why sometimes second opinions can really broaden your options. So I think it can really facilitate communication, because patients are able to understand and follow along better, because they understand more of the jargon that we're using.
At Sylvester, as an institution, does it, and sometimes hospitals will give seminars to patients, or kind of like that kind of information. Does Sylvester ever embrace that to like inform patients on how to responsibly use AI for their healthcare, specifically cancer care?
I don't think we have done a conference on that, but we recently had a precision medicine conference, and I had the patients symposium part of that. And we had a lot of conversations with patients and advocates about how they're using these tools, which sites are helpful, and how to kind of feel comfortable advocating for yourself and bringing those questions forward. But our cancer center, like many cancer centers, really want to increase the amount of information and open this communication, because the system, especially big cancer centers, are so complex. Like we're not at the time that there was a family doc that was serving a community, of a small community. Now we have a lot of patients and not that many providers, so we have to rely on AI. We have to rely on electronic medical records that people can text us frequently about their symptoms and their questions, because there's not enough of us. So I think all of this technology is not bad. It's actually a good way to increase the communication with patients. And yes, we need to kind of help our patients, kind of guide them to what's the best use of it. And we're slowly getting there. One of the things that we're very proud of is that we have something called My Wellness Check, where we constantly kind of are interacting with our patients to see how they're doing on treatment. And that's actually informed by AI and large data, because we are able to learn and stay in touch with our patients more often. It might feel a little foreign and impersonal to some of our older patients that we're asking them to communicate online, but it's actually a good way to follow patients when we're not able to see them every week, because that's getting harder and harder when we have such a large volume.
My next question is actually a two-parter on the same kind of thing.
Yeah.
When I was at the IMIG conference last year, there is a research group out of Scotland that is developing a better way to model tumors in the thoracic cavity using AI. And it's to better inform them on staging and the type of treatment that they could give a patient. Where do you see AI being used on that side? Not with the patient yet, but where do you see
the research
AI in like 10, 20 in a research level? Where do you see that going?
Yeah, I mean, I think that it is gonna make us go fast forward in terms of what we can achieve for patients, so that we will be able to take the data of rare diseases and combine the data of many countries. So I was at that conference too, and the exciting part of the IMIG consortium is that this is a rare disease where if you combine the data of imaging studies of people in UK and imaging studies of patients in Australia and imaging studies of patients in the US and Latin America, you can get a clearer picture with all this large data, and AI can help us do that, where we can understand actually, like, maybe the patients are responding to immunotherapy. We look at imaging studies differently, or maybe we can do trials where we don't need to wait 10 years to get an answer. Like maybe AI can create, there's all this modeling where you can create the control arm by using data of other trials, and then kind of modulate what this arm of the study will look like and compare it to your intervention, and then move science along faster. And if there's one group that needs science to move along faster is mesothelioma, because it's a rare disease. It's actually very predominant in countries where there's not a lot of investment, and even in a country like the United States, there's not as much investment as we need. So AI is going to help us not only get patients kind of to par with knowledge, but also maybe bring in this kind of orphan disease to the point that we can move farther faster with research. So I do have a lot of hope that I hope that in the next 5 to 10 years, these conversations about the trials and devising trials that we can do internationally is going to go faster.
And then the second part of the question, similarly, where do you see patients and their loved ones using AI 5, 10, 15 years from now?
Yeah, I mean, I think that the same way that, our kids and my kids use their phones to learn, I think patients will have at their hand a lot of their own medical information, and they'll be able to match themselves to trials in ways that they were never able to. Maybe we'll be able to do, home testing for things that we can test by swabs in the mouth, and we can understand about who's the best patient for those. So I think there's going to be a lot of opportunity for patients to have a more personalized experience about their own diagnosis, because mesothelioma, even lung cancer, where we have made a lot of progress understanding biomarkers, and we have 13 actionable mutations that have their own specific diseases. So we are learning that even non-small cell lung cancer is not one disease, it's many small diseases with different mutations. And mesothelioma is in the beginning of that. Like, we don't really understand how every mesothelioma will play out, like how some patients with mesothelioma do well for years, and some patients have more aggressive disease. Some of it is how things look under the microscope. A lot of it has to do with the patients on genetic makeup and the environmental exposures and the biology of the cancer. So I think AI will help us learn this for every patient faster. And in doing so, patients will be able to match themselves to the best treatments, either with the best trials or the best doctors that are going to meet their needs.
So as patients do participate in their own knowledge base of mesothelioma, what would you say is the one thing that you would tell all patients who, let's say someone comes in already and maybe they did not come prepared with a list of questions or or maybe minor knowledge of either their diagnosis or the treatment? What would be the one piece of advice you would give someone if they want to go search for information online, specifically using AI?
Yeah, I mean, I will say it is a tool for education, almost like going through a library and getting information in a faster way. It empowers you and makes you, a better advocate for yourself. But it really is not a substitute for a medical team or medical advice, because it's a rare disease where there's a limited amount of data in the internet. So you're not going to get the full picture. So bring those questions to the clinic, find the doctors that know about your disease and have experience, because the best outcomes will happen when the patients are informed, they're getting in front of the right team, but an experienced clinician and an informed patient work together. So I think you need both to get the best outcomes. But if you do them separately, if the doctors go out there right now in the internet, they're not going to get all the options they need. They're not going to get all the answers they need. And you need to be with a team that knows about your disease, and you need to work together.
Excellent. Well, this has been a really good conversation. Is there anything maybe that we haven't covered that you would like to sort of explain a little bit more about, or maybe the work that you're working on right now?
Yeah, one of the things, clinical trial matching is something I'm very passionate about, and how do we fill the gaps of parts of our communities who never really get referred to trials. And I think when you have a rare disease like mesothelioma, where there's treatments that may not be curative, every patient should have a conversation about trials. So this is something that I'm very passionate about. I think in the whole AI sphere, I think I don't think doctors and oncologists are ever going to be replaced by AI, because the experience of mesothelioma is so personal, and the symptoms that you need to manage require a lot of handholding, and not only of the patient, but the caregivers who really help us take care of our patients with mesothelioma. So I think patients will be here. AI will help us communicate better. But I hope that all the patients who are listening find a team that fits their needs. And sometimes that means going to another state. Sometimes that means going to another city and changing doctors. And I think that's one thing I will tell patients, especially patients with mesothelioma. Don't be afraid to go ask for answers somewhere else. And don't be afraid to break a relationship with a team that is not serving your needs. Because at the end of the day, it's about your care. And if you finding that people are not listening and there's no options, maybe you need to go somewhere else and ask and keep asking. So I think that would be my message, that empower yourself to keep asking, empower yourself with second opinions, empower yourself with the opportunity to learn about clinical trials.
And again, talking about the clinical trials, we are always trying to promote clinical trials as well. We have it in all of our informational pages, like the benefits of it. Funding is an issue, obviously. Finding the right participants is an issue. What do you think is really the biggest issue, or maybe it's one of or both of those, to get people to a clinical trial? Is a lack of sufficient knowledge about the trial? Is it a fear of maybe taking something that's experimental? What is the biggest hurdle that researchers have to actually get people into a trial?
Yeah, I mean, I think there's a lot of misconceptions about people being guinea pigs and that they're being experimented on. And at some point, academic medicine did some of that. But that's a long time ago. There's a lot of safeguards for safe clinical trials. And I think you need to give yourself all the options in front of you. But I think it's important to at least bring it up to your doctors so that we can find the options. I think at the end of the day, in mesothelioma, the biggest gap is that we don't have enough trials. I mean, we actually have patients who want trials and they have to travel, like they're not in your neighborhood. So I think here unlike non-small cell lung cancer, where there might be a lot of trials, in mesothelioma, they're more limited. And sometimes the patients are afraid that they're gonna get a placebo. And actually that's rarely the case. Most of the trials for new drugs are either phase 1 and phase 2. Every patient gets a drug. And that's what we want. I mean, we're referring you for our trials because we don't think what we have is the best option for you, or we think there could be something better. So at least give yourself the opportunity to at least hear about the trials and see if there's an option near you, or try to find an option for you.
Well, thank you very much again for joining us. I really appreciated the conversation. This is something that our users are interested in. Everyone's always reading about AI, the dangers of it, how it's helpful. The clinical trial conversation is great too. So yeah, thank you very much. I really appreciate you taking time and joining us.
Right. Thank you for the invitation.
All right. Thank you very much, Dr. Rodriguez. Bye-bye.
Have you or a loved one been exposed to asbestos? You may have legal options. Contact the Mesothelioma Center at asbestos.com or call 833-628-8546 to reach one of our patient advocates today. Got an idea you think we should talk about? Or maybe you'd like to join us on our podcast? Please email us at podcast@asbestos.com.